What we built is a prototype for something that doesn't really exist yet, a meaningful, accessible way for high schoolers to explore what it's like to be a nurse before committing to a nursing program. We built it in ThinkLink, and we'll walk you through the live experience after the slides. Okay, a quick roadmap. We've structured this to follow the rubric directly, instructional context, the technology, then how it supports content, engagement, and assessment, and finally, why this design improves learning beyond what's already possible without the tech. Rubric numbers are on each section header, so it's easy to follow along. Nursing is one of the most popular undergraduate majors in the country. A survey from 2024 found that the enrollment grew nearly 5% or over 12,000 new students in a single year. And yet, the resources available for actually exploring nursing before you commit are almost non-existent. The reason is structural. Clinical environments are tightly controlled by HIPAA or patient confidentiality. An untrained student can't just walk into a skilled nursing facility and shadow a nurse. So students end up committing years and tuition to a career they've never truly experienced up close. Our course targets high schoolers considering nursing. 3 learning goals guide everything else in the design. First, the ability to describe a RN or nurse daily workflow. Secondly, understanding the coordinating aspect of the role, which is how nurses interact with interdisciplinary teams and families. Thirdly, we want students to grasp why patient advocacy and emotional support matter in long-term care. You'll see these come back in our conclusion. The technology we use is ThinkLink, an immersive learning platform that can create interactive 360-degree scenes, host 3D models, support branching scenario assessments, and has accessibility features built in. 4 capabilities matter for this project. First, 360-degree scenes. Learners can rotate through a fully panoramic environment. Second, hotspots. Clickable elements in the scenes surface text, audio, video, or 3D models and context. Third, branching scenarios. Choice and consequence pathways where decisions lead to different outcomes. And fourth, accessibility tools. An immersive reader that adjusts display settings and reads content out loud, and an accessibility player that reformats the entire course for screen readers. The platform works on mobile, desktop, and VR for a K-12 audience on their phones. This is very helpful. The theoretical anchor here is situated learning theory, which argues that the most effective learning happens in the environment where the knowledge lives. A textbook describes a skilled nursing facility. ThinkLink puts the learner inside one. These immersive qualities change how learners interact with the content. When a learner reads about medication cart safety rules in a hotspot while they're standing at the medication cart in the 360-degree scenes, that information is connected to a context. Situated learning theory tells us that knowledge gained in context transfers more easily to a future real-world setting. So the 360-degree environment isn't decoration, it's doing instructional work. The learner also starts to emulate expert behavior by navigating the same sequence of decisions a nurse makes during a shift. They are not reading about what they are doing, they are practicing the clinical reasoning skills necessary for nursing.
One of the first things we noticed in building this is how different the experience is from passive content delivery. A learner in ThinkLink isn't scrolling. They're rotating in a 3D environment and choosing what to look at. On a phone, desktop, or even VR, you can pan around and be in the nurse's station. ThinkLink's hotspot design gives the learner agency. They decide what to examine and in what order. A study by Jeffrey and others found that ThinkLink increased engagement in hybrid learning environments, especially for simulation-based tasks. The other piece is Gagne's 9 events of instruction at the retention stage, which is that content anchored to a specific place is stickier than a standalone link. The pharmacology video we embedded in the patient room is experienced differently than a YouTube link in a Google Doc. The learner encounters it while they are standing in that room. Lastly, the formative quiz after the scene builds momentum towards the summative scenario. It signals to the learner what they should be paying attention to. How it supports assessment. First, assessment works at 2 levels. Formative assessment happens after the 360 scene, where the learner takes an in-context multiple-choice quiz. Wrong answers don't just fail them, they give an explanation. The goal isn't to make sure students pass or fail, it's to build knowledge for what comes next. Second, there is a summative assessment, the branching scenario. The learner plays a charge nurse dealing with a patient with dementia who is refusing medication. Every choice has a consequence. The preceding content directly prepares them for the scenarios they'll face, which is our scaffolding of being a charge nurse without the risk of the actual scenario. From a UDL perspective, ThingLink meets CAST's assessment recommendation. This means that it is personally relevant, automatically scored, with embedded scaffolding. There's also one thing to note. Because this is an exploratory course with retry allowed questions, raw score isn't very meaningful. Completion rate is a better metric. Instructors can grade on participation instead. Why did we use ThingLink, and why this design rather than something simpler? First, we considered access. There is no alternative for a high schooler to get this experience, especially when they cannot easily volunteer at nursing homes where there is liability and patient privacy restriction. ThingLink bypasses the liability and logistical barriers that would otherwise block entry entirely. Second, we considered consequences without risk. The branching scenario lets learners make real nursing decisions and sees what happens. It simulates a real clinical setting while having a student who has zero training. Third, we considered narrative. The scenario introduces a patient with a name, a backstory, and a personality. The learner starts to feel the weight of caring for someone who can't always communicate clearly. Compassion fatigue, for example, is experienced in this narrative format. And fourth, we experimented with context-anchored media. That changes how typical content such as video, text, and image is processed and retained. In conclusion, the rubric allows us to show intentional alignment, that technology choices, instructional strategies, and learning goals work together as a system. This table shows the learning goal, instructional strategy, and technological affordance. Goal 1, describe RN workflow, is served by the 360 scene and hotspot exploration. Goal 2, interdisciplinary coordination, is served by content embedded in scene about the care team. Goal 3, patient advocacy and emotional support, is served by the branching scenario with its narrative backstories and consequence first design. In summary, you don't need to shadow a nurse to understand what a nurse does. Next, we'll walk you through the actual experience with the demos in ThingLink. I'm going to go through the learner content in this part of ThingLink, and the next part will be the live demo of the branching scenario pathway, which is the summative assessment. There's a share link in the top right, which will share this whole course. So going through the course, I start off with images and text, which is the primer, and then it goes into the immersive 360 scenes later. I chose the idea of a day in the life of a nurse, specifically a charge nurse at a skilled nursing facility, and the learner will go through what a nurse goes through every day, including hands-on patient assessment, clinical charting, and safe medication management. They'll see what the nurse does when they communicate with different coworkers and teams, such as physical therapists, occupational therapists, and then they'll see emotional scenarios and how nurses deal with patient advocacy and even drawbacks such as compassion fatigue. I start by covering the content areas, and in this slide I have some real nursing station. And one of the challenges of getting pictures of nursing stations or making an immersive scene out of it is HIPAA restrictions and patient privacy rights, as well as sensitive data. So I used ChatGPT to create an immersive scene, and that's what we'll see today. So this first scene is the nurse's station. I think this generative AI image did a pretty decent job. I added hotspots where the users can click on certain spots, and it turned out to have a lot that a typical nurse's station would have. So let's start by going through this first one. I have an image of a nurse. This was taken from stock images, and it describes how a nurse would interact with interdisciplinary teams. There's some binders here that are about charting and medical history and going through all the records of a patient. On the wall is a hotspot about compassion fatigue, burnout, and the emotional demand of being a nurse. On the side is how nurses have to interact with patients and their families. And the medication cart gives you information about why a nurse has to keep this cart strictly supervised or locked at all times as part of their safety protocols. In the next part, you immediately go into an in-context, formative multiple-choice question. Which of the following is a critical safety role for an RN managing a medication cart at a SNF or skilled nursing facility? And it moves on to the next section about leadership. I threw in this 3D model of PPE, which is in this case a surgical mask that a nurse would enforce as part of infection control procedures. And this hotspot goes more in depth about what kind of mask this is. I bring up that compared to N95 masks, which were used during the pandemic, the surgical masks were not used for infection control for COVID-19. There were some free models from Sketchfab, so this is where that model came from. It's helpful as a visual artifact to interact with it, and it sticks in the brain more than an image. There are also some objects in the medical field that might be helpful to visualize by rotating around. Next is talking about a patient and being in a patient's room. So I created this scene again from ChatGPT. There are some issues with the scene about it being a skilled facility room, but kind of merged with more advanced hospital technology, such as this monitor here. So I highlight this infection control spot. There's also the patient bed, which talks about assessing a patient. And another one is this hotspot that refers to medication, and I embedded a YouTube video, and the YouTube video is informative for this scene. So next, multiple choice question again, and then the conclusion.
Hi everyone, I'm going to briefly walk through the summative component of our thing link. This part was somewhat challenging to design because the course itself is meant to be exploratory. Additionally, our target audience was high school kids who do not typically have a lot of clinical or technical knowledge, so this wasn't something that we could test them on, nor did we want to test them on. Instead, we wanted the assessment to build directly on the content delivery module that Jared has already presented on, while still helping students better understand what it is like to think and make decisions as a nurse. With that in mind, this is what I came up with. So I will play a video of me playing the module, and then hopefully I can pause and build more context for what's happening. Yeah, so students start off in this hallway that's supposed to be before they enter the skilled nursing facility as a nurse. The first two cards that will present itself provide an overview of the module, including the learning objectives. As you guys have probably noticed, there is audio embedded into the module. I was hoping this would make things more engaging and immersive. So before students can move on to the next scene, they're asked this question. You arrive at the facility, where should you go first? Nurses, whenever they arrive at the facility, they should go to the nursing station to do morning handoffs, where they get a debrief of what happened with their patients while they were gone and who they should go see. For the sake of explaining this module, however, I will click one of the wrong answers. In this case, I'll click the water cooler to talk to your favorite coworker. So as you will see, the feedback that students get whenever they answer the question wrong is immediate and also pretty extensive. And this is on purpose because our target audience, once again, is high school kids who don't have a lot of technical or clinical knowledge and are completing this course for exploration. So whatever feedback that is included in this module either references content that Jared has already covered in his module, or it sort of just straight up tells them what the right answer is so they can click through and complete the module and get an idea of what it is like to be a nurse in a skilled nursing facility. So once you are at the nursing station, you meet up with your coworker, Hannah, who is the night shift nurse who has been covering your patients while you have been gone. So if you read this big blurb, you'll see that Hannah's pretty tired after working all those hours, and she's wishing you good luck as she's handing you the papers. So you'll also see when you read this big blurb that this module is pretty narrative heavy, and I did this hoping to make things more engaging and also as a way to make the module more cohesive. So on that card, there was like a summary of what Hannah wrote on her morning handoff notes, but it also serves a secondary purpose as like a task list or a little preview of what students will have to complete before they can complete the module. So think of it as like maybe an agenda or all the things you need to do before you can complete the quest. For this module, students will have to go through patient rooms and scenarios in order to be done. Again, I'll press the wrong answer so you guys can see what happens. So this is Mr. Alvarez, who is experiencing episodes of confusion and disorientation. This is what happens whenever you get the right answer, but if students didn't pick the right answer, they would get feedback to direct them towards the correct one. So I'll just quickly click through this. So this is Ms. Franklin, who's a new admit to the facility. And I did add audio to these rooms, but I'm thinking I might remove it because it is a bit distracting. So those last few scenes and questions were meant to emphasize the realistic dynamic between a CNA and a nurse in a skilled nursing facility. In a skilled nursing facility, the nurses oversee the CNA usually. So this is Mr. Chen, who is refusing wound care. You decide to talk to him. While you're talking to him, a CNA interrupts you. She's new, her name's Michelle. She's not sure what to do because a patient with dementia is refusing to take his medication. He keeps saying that the medication is poison. So unlike the previous questions, in this question, there are branching scenarios. So whenever students click an answer option, it takes them to a different outcome or a timeline. For the sake of expanding or explaining this module, I'll click through all the different branches or possible timelines. This is what happens whenever you tell the CNA to demand that Mr. Henderson, our patient, take the medication. So Michelle gets hurt because the patient gets aggravated. Yeah. And then this is a summary of what you will have hopefully learned when you click on this outcome. This module is set up so that if students click the wrong answer, they can go back and explore a new outcome or try again. So moving on to the second branch. This time around, you have the CNA leave the medication next to his bedside table, hoping that he will take it whenever he is more calm. The outcome of this is that the nurse or your job is not at risk because medication should never be left out unintended in a skilled nursing facility because that can be a hazard to patients. In this case, a state surveyor who comes and checks to make sure that the skilled nursing facility is up to standard saw this, and now this is also putting the facility at risk. A summary of what you will have hopefully learned. Let's try again. All right, on to the final and correct answer. So you ask the CNA to make sure Mr. Henderson's room is not overstimulating, and you go talk to him after a few minutes. So Mr. Henderson is calmer and he's a lot more receptive. In real life, that might not be the case, but for the sake of this demo, I did create simpler situations and responses. Yeah. So this question is just to reiterate what Jared's module has covered, which is that we should respect patient autonomy and independence. When you make the correct choice, you also unlock some new scenes where the patient's family, his daughter in this case, comes and visits. And then here you are calling the physician to further advocate for Mr. Henderson to get his medication changed. So a summary of what you will have hopefully learned. And that's the end of that. So something else I want to briefly mention is that the last two scenarios are intentionally similar as a form of scaffolding in hopes of helping the students make the correct choice, even though they don't really have too much clinical and technical knowledge. Really briefly, I want to touch upon how at the end of the module, there's a results page that pops up. This result page isn't too helpful for our course since our course is exploratory, and the students can re-answer the questions until they get it right. So this means that as long as they complete the module, they're bound to get 6 out of 6 correct answers. However, I can see this being useful for other courses or modules. For instance, score points received is referring to the fact that educators or designers who use ThingLink can attach or assign a score to questions. And so if the student gets the question right, they'll get like 1 point. And then you'll be able to see at the end if the students gathered as many points as they need to pass. For our case though, yeah, I'm not sure how helpful it would be, especially since the scenario completed, for instance. If the person who had been going through this module had chosen the right answer the first time around for the branching scenario, and they didn't go through the other 2 branches, then their score for completing the scenarios would have been like 63%, I think, or something like that. So yeah, it's not too helpful for our case. However, I will mention that if you have a premium tier for ThingLink, it provides better result analytics. And one thing that I think would be really helpful for us is being able to see the routes that students take and scoring them based off of that versus scenario completed. And yeah, that's something that's available only in the premium feature.